PSC NURSE പുതിയ വീഡിയോയിലേക്ക് സ്വാഗതം. ഫണ്ടമെന്റൽസ് ഓഫ് നഴ്സിംഗ് പാർട്ട് 2 40 ചോദ്യങ്ങളും അവയുടെ ഉത്തരങ്ങളും ഈ വീഡിയോയിൽ ഉൾപ്പെടുത്തിയിരിക്കുന്നു. വീഡിയോ ഇഷ്ടപ്പെടുന്നവർ PSC NURSE എന്ന യൂട്യൂബ് ചാനൽ സബ്സ്ക്രൈബ് ചെയ്യുകയും ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. നിങ്ങളുടെ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുക. പഠിക്കുന്ന എല്ലാവർക്കും വിജയാശംസകൾ. വീഡിയോയിലേക്ക് കടക്കാം. Dash is a type of fever where temperature rises from normal or subnormal to high fever and back at regular intervals. Intermittent fever or quotidian fever. Dash is a type of fever in which the highest range of temperature is recorded in morning hours and lowest in evening. Inverse fever. In dash fever, the difference between the highest degree of temperature and lowest degree temperature is very high. Hectic or swinging fever. Dash is one in which there are brief febrile periods followed by one or more days of normal temperature. Relapsing fever. Dash is a sudden severe attack of shivering in which the body temperature rises rapidly to a stage of hyperpyrexia. Rigor. When the body temperature rises above 105 degree Fahrenheit is called hyperpyrexia or hyperthermia. When the temperature falls below 95 degree Fahrenheit or 35 degree Celsius, it is called hypothermia. Dash is an indicator of circulatory status. Pulse. Dash is the pulse point which is usually used to count the pulse rate in infants. Apical pulse. Sites of pulse palpation: temporal, carotid, apical, brachial, radial, ulnar, femoral, popliteal, posterior tibial, dorsalis pedis. A pulse rate below 60 is dash. Bradycardia. A pulse rate above 100 is dash. Tachycardia. Regularity of beat is called dash. Rhythm. Stimulant drugs like caffeine, atropine, adrenaline will dash the pulse rate, and administration of sedatives can dash the pulse rate. Adrenaline will rise and sedatives can reduce the pulse rate. Difference between apical pulse and radial pulse is called dash. Pulse deficit. Dash is one heartbeat and two arterial pulsations, giving the sensation of a double beat. Dichrotic pulse. Dash is a type of pulse in which beats are missed at regular intervals. Intermittent pulse. Rapid contractions in the atrium causing irregular contractions of the ventricles in both rhythm and force is dash. Atrial fibrillation. Dash is the rapid and fatal twitching of the ventricles. Ventricular fibrillation. Dash pulse is a full volume pulse but rapidly collapsing pulse occurring in aortic regurgitation. Water hammer or Corrigan's pulse. Rhythm is regular but volume has an alternative strong and weak character is dash. Pulse alternance. Dash is accompanied by regular rhythm in which every other beat comes early. Bigeminal pulse. Respiratory center is located in the brain in dash. Medulla oblongata. Respiratory rate over 24 breaths per minute is dash. Tachypnea or polypnea. Respiratory rate is less than 10 breaths per minute is dash. Bradyapnea. Dash is the total stoppage of breathing or stoppage of apnea. Dash is increase in depth of respiration. Hyperpyrexia. Condition where the patient can breathe only in upright position is dash. Orthopnea. Dash is a noisy breathing seen in alcoholic patients. Stertorous respiration. Dash is a harsh, vibrating, shrill sound produced during respiration seen in upper airway obstruction. Stridor. An abnormal bubbling sound caused by mucus in the air passage is dash. Rail. High-pitched musical whistling sound that occur with partial obstruction of bronchi is dash. Wheeze. A very deep inspiration followed by prolonged expiration is dash. Sigh. Dash consists of series of expirations which gradually becomes deeper and noisier until a climax is reached. Then a pause and then cycle is repeated. Chain stops respiration. Labored or difficult breathing is dash. Dyspnea. Dash is the bluish discoloration of skin and mucous membrane caused by lack of oxygen in the tissues. Cyanosis. Lack of oxygen in tissue is dash. Hypoxia or anoxia. Lack of oxygen in bloodstream is dash hypoxemia or anoxemia. Dash is the state of suffocation produced by prolonged insufficiency of oxygen. Asphyxia. The most appropriate position for a dyspneic patient is dash semi-fowlers. Thanks for watching. PSC NURSEന്റെ വീഡിയോകൾ ഇഷ്ടപ്പെടുന്നവർ ഈ ചാനൽ ലൈക്ക് ചെയ്യുകയും നിങ്ങളുടെ വിലയേറിയ അഭിപ്രായങ്ങളും നിർദ്ദേശങ്ങളും കമൻറ്റ് ബോക്സിൽ രേഖപ്പെടുത്തുകയും ചെയ്യുക. സ്ഥിരമായിട്ട് വീഡിയോ റിപ്പീറ്റ് ചെയ്ത് കാണാൻ ശ്രമിക്കുക. എങ്കിൽ മാത്രമേ നിങ്ങൾക്ക് പഠനത്തിന് സഹായമാകുകയുള്ളൂ. നന്നായി പഠിക്കാൻ ശ്രമിക്കുക. ചാനൽ കാണുന്നവർ സബ്സ്ക്രൈബ് ചെയ്യുവാൻ ശ്രമിക്കുക. ഫ്രണ്ട്സിന് ഷെയർ ചെയ്യുകയും ചെയ്യുക. എല്ലാവർക്കും വിജയാശംസകൾ. നന്ദി, നമസ്കാരം.